Let's talk about red light therapy. What's the role of red light therapy in human medical use as of right now? I did a deep dive into it because this is trending. You see it in different locations, med spas and so forth. So red light therapy is superficial, is the best way to put it. At this point, there is some evidence about helping with wrinkles. So there's some evidence with it. I recommend it if you're gonna do red light therapy, you probably need to do it with a dermatologist because there's a certain frequency and power that needs to go with it. And the good news is it's pretty safe. If you're gonna do this red light therapy, you're gonna put one of those masks on and try to get rid of your crow's feet or something like that. Just protect the eyeballs. There's some concern about it getting into the retina and injuring the eyes. So just have like some shades or something to block it so you're not staring at it during that time. So it is a superficial cosmetic play as of right now. Definitely good for hair growth. There's some evidence. I think the evidence is pretty convincing that it will help grow back hair. So some of those the cool helmets that you're seeing, they probably do work, right? And then with the wrinkles, I'm not very impressed with some of these studies I saw, but it's a play, I think. There's also a play for acne that a small study showed there was about a 45% improvement in acne with using the traditional therapies. There is some ongoing trials. There was one study talked about rheumatoid arthritis and having pain, and it helped in that pain. Okay, that was interesting. Not the go-to for treatment for rheumatoid arthritis, but then again, there's not much harm with it, so you can try it. It's just a question of, is the energy of the beam getting down into the joint is what I would be most concerned about. But if it's, kind of placebo and you're gonna put red light on your joints that hurt and you're in acute flare for your rheumatoid arthritis and you're already on steroids and you're using something else, is it gonna harm you? Probably not. So it's one of those, there's probably some benefit and very low risk, so I would categorize red light therapy for that. If someone's trying to sell you red light therapy for anything else, if it's going to be like for weight loss or to decrease the visceral fat or to decrease the subcutaneous fat, absolutely zero data at the time of the recording of this video. Now, what's the basic science behind it? It's solid. So when you go look at some of these studies online that are published, it does help create more ATP down to the mitochondria of this cell. And that's where this all started. And on a very basic science level, they can show that in the lab that at certain wavelengths of red light, that it will cause more ATP production, and at other wavelengths it inhibits. And so there's a play there. I think it's very exciting. NASA did a study on it too, on wound healing, and it might be promising, but we are far from making this a definitive option to wound heal or for anything else to increase ATP. Now that's very exciting because some of the other things that are out there, that's what we're trying to do, like creatine does that, right? Creatine creates more ATP in the muscle so you can work out longer and have more endurance when you're doing your lifting. You're like, okay, hey, I want to grow my muscle, or you need more endurance because it's pushing more ATP production within the skeletal muscle system. Definitely light therapy. Photomodulation is the most recent term on it. There is a play, but it is in the early parts of it, and there are some human trials. Hair, skin, I think if you want to try it, just protect the eyeballs. And that's my best advice. You'll hear things like, I think there's a podcast about the UFC president. He has a red light booth in his house that someone created for him because he feels better. Well, then great. I have a patient who has a red light booth, and she says she subjectively feels better with it. And I'm like, well, is it placebo or not? Or is it the fact that you had 30 minutes completely by yourself in that red light? You know what? Who cares? Because it makes you feel good. And you're in there, it's not gonna harm you, it's not gonna cause skin cancer. As far as we know, the wavelength is not in danger of that. And just as long as you're paying attention and you don't cook yourself. If you're using an LED, it's really hard to do that because it's low power. But it's such a low cost, you can get them, and then you just have to be aware with the commercial branded red light, it's not gonna be as powerful as the medical grade. And I recommend that you at least talk with a medical professional who's who understand this, and if you're gonna do it, you do it under some supervision. That way you don't harm yourself, especially the eyeballs, if you're getting the red light right around here because you're worried about the wrinkles. Maybe I'll try it. Hope that helps. I'll see you at the next video. Happy Doc out.